E02 enebo Ghana eso enie sibise enebo Africa.
Aside the yellow skin, the yellow face, the yellow eyes that we use to diagnose a child of having jaundice, there are other more medical ways we can diagnose a child with jaundice. So we have one we call TCB. Okay, it's a machine, and then we press it to the child's skin. The number it records will let us know if the child is truly jaundiced or not. And then we have serum bilirubin, that's blood bilirubin. With that one, we take blood samples of the child. We send it to the lab, they run their test, and then they figure out the amount of bilirubin in the child. And then, like I said, there's a range that I don't want to get into. But when you get your lab results, you see the range. So if it's above the normal range, you know this child has jaundice. Okay. Some children will present with yellow skin, yellow eyes, yellow everything. But when you take this TCB, you take the serum bilirubin, you test it, the jaundice level is very low. Those children don't need to be treated. Like they are just presenting with the yellowness, but it's not really, they are showing more than they have. It's quite, sometimes it happens. And then other children who will not show so much yellowness, but you test, you take their blood samples, and then you see that the jaundice level is very high in their system. So even though we see yellow and then we are like, this child has jaundice, we still have to do the TCB and then the ASB, preferably the blood, the serum bilirubin. That's the most important one. We have to take blood samples and then see the amount of bilirubin in this child before we start the treatment. Okay, we like to take samples before we start treatment so that we can compare. Later we'll retake samples and then we'll compare if the treatment is actually working. We compare the first results to after the baby has been under the phototherapy. We compare that result and then we see if the treatment is working. So these are the ways to diagnose a child of having jaundice. Aside from seeing the yellowness, you have to take blood samples to the lab to test and see the amount of bilirubin in the child to actually confirm that this child has jaundice. So if you are home, obviously you don't have the ability to take blood samples. So as a mother, a newborn mother, an auntie, whatever, if you see that the child is not looking pink like he or she normally does, but the child is presenting with yellowness, just come straight to the hospital. You can't take blood samples. You don't have the TCB machine. So come. We see that your child is yellow, and then we take blood samples to actually test if your child is yellow. And then the amount of bilirubin in your child's blood will determine if your child is going to get treatment or if you just go home or if it's just the normal process your child is going through. Like I said earlier, children go through this process. So maybe yours is just going through the normal process or yours needs help to go through the normal process.
And then this is E02